And over to you, Lorna, in 5, 4, 3, 2.
Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. As usual, joining us today is he's not here. The acting health officer is not here today, but Dr. Earl Strutter is here, who's Assistant Chief Administrative Officer, as well as Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. And today we have two special guests. Joining us today is Karen Nelson, President of Maryland Planned Parenthood, as well as Jamie Swierczkowski, I hope I pronounced that correctly, who is the President of the American College of Nurse Midwives Maryland affiliate. I'm Lorna Vigili, Hispanic Public Information Officer, and the way we're going to do this, reporters, today is the County Executive is going to do some opening remarks, then our two special guests will do remarks, you will do your Q&A portion, and then we will continue with the COVID-19 public health update. And with that, I toss it to you, Mr. County Executive. Good afternoon.
Good afternoon, and I want to thank everybody for joining us this week. This week is both National Nurses Week and National Women's Health Week. I want to extend my thanks and gratitude for all the nurses serving our county residents, including the approximately 300 nurses we have working in our HHS department and over at MCPS. Over the last 2 years, nurses have been on the front line working nonstop, dealing with this pandemic while also serving sick and injured, from treating colds to dealing with cancer. In other words, the regular routine didn't change one bit, and they had a massive pandemic visit them on top of that. And I just, deeply appreciate the work that nurses have done, often underappreciated. And I don't know how if people realize how much extra work and the circumstances that people had to work in. I know that I was always struck by the difference between our, for example, staff beds and our total beds, and knowing that unstaffed beds meant that nurses were doing double duty to provide services to people. That meant they didn't have the staffing levels in the hospitals that they needed. And I remember the dark days when this all started, when nobody had personal protective equipment, when the hospitals were struggling to get basic things like masks and gloves and actually get decent masks. And we were, called upon to actually help the hospitals with supply in the early days. Folks went to work despite putting themselves in danger. And I think that's true in Montgomery County, and it's certainly true nationally, that people put themselves at risk because that's what their job meant they had to do. And even knowing that we couldn't adequately protect them, because if anybody knew the shortcomings of what we were doing, it was the people of the front lines of healthcare. They kept doing their job. So I just want to be really clear that I greatly appreciate what you all did, not only in the county, but you did nationally. We know that we're seeing burnout and stress from this profession, leading to nurse shortages. You could add pay to the issues leading to nurse shortages. Nursing is a difficult job in the normal world, and long hours and intense conditions while being overworked and often undercompensated can be discouraging for people. And our nurses deserve not only to be appreciated every day, but to be paid and recognized for the value of the work they do. I, felt many times during the pandemic that people referred to as essential workers weren't actually treated like they were essential. And I just want you to know that, to me, you were and are essential. Unfortunately, as we celebrate the contributions of nurses, there's a political and legal assault on the reproductive rights of women occurring. Nurses face the threat of being jailed in parts of this country for doing what we are honoring them for this week, which is caring for others. And this is absurd and outrageous. No matter what happens elsewhere, we must act to protect reproductive choice and women's health. We're going to do this in Maryland, and we're going to do this in Montgomery County. Even though abortion will remain legal and safe in Maryland and Montgomery County, we're not going to be able to avoid the residual impacts of this ruling from neighboring states like West Virginia, and the impact it will have on our maternal health system. As was mentioned at a press conference yesterday, Planned Parenthood leaders here in Montgomery County say we're already seeing women coming from other states like Texas to remain healthy and to remain free from persecution and frankly prosecution. Yesterday, I recommended a supplemental allocation of $1 million to create a fund that will ensure increased access to maternal health, family planning, and abortion services. This funding for our nonprofit providers in our county will help serve the growing need by assisting with wraparound services for those who are using abortion services, as well as for those who choose to have children, providing grants to organizations in the county that provide these services, support organizations focused on comprehensive family planning, reproductive health, and maternal health, and providing aid to organizations that are fighting legal battles on behalf of women. I'm confident that the County Council will approve this funding. I'm very appreciative of their support and the unity we have on this issue. We were all there yesterday when we announced this, and I'm confident this is going to get passed. I also want to thank our state and federal elected officials who are also working to support women's health and women's fundamental rights while addressing the detrimental impacts of this potential court ruling. Our state's General Assembly saw this writing on the wall, and we're fortunate for their foresight. This past session, the state legislature passed legislation sponsored by Delegate Ariana Kelly to expand training and available providers for abortion services. Unfortunately, the governor is refusing to provide early funding. When the legislation was passed, this potential sudden change in policy wasn't imagined as happening as soon as next month. But that future apparently is now, and it would be appropriate for the governor to acknowledge the changing circumstances and to move things forward. So I'm going to continue to urge the governor to change his mind on this, and I want to thank Delegate Kelly and her colleagues from the House and Senate in asking the governor to join in this fight. Montgomery County is ready for this challenge, and this fund will include grant opportunities for organizations to train providers. I'm pleased to be joined today by co-CEO of Planned Parenthood Maryland, Karen Nelson, and President of the American College of Nurse Midwives Maryland affiliate, Jamie Swetlakowski, to give some brief remarks about their concerns and approach to these issues moving forward. I'm now going to turn it over to Karen and Jamie, and after that, we'll take some questions on this. So thank you, both of you, for joining us today.
All right, ladies, who goes first?
I can go ahead and go first.
Thank you, Jamie.
Sure. Hi, everyone. Like I said, my name is Jamie Swetlakowski, and thank you for giving me the opportunity to speak today on behalf of the Maryland affiliate of American College of Nurse Midwives. I shudder at the thought of living in a country where pregnant people will not have the ability to access safe and legal abortions. No longer being able to access safe and legal abortions will have devastating effects on tens of millions of Americans. The consequences of the Supreme Court eradicating protections to abortion rights will not affect Americans equally. The consequences will be they'll disproportionately affect poor people and people of color. People with money will be able to travel to access abortions. People who face barriers of financial means, transportation, reliable childcare, or lack of paid leave to travel out of state to access abortions will disproportionately carry the burden of this elimination of rights. Because carrying a pregnancy to term is riskier than legal abortion, states' restrictions on access to abortion will lead to more maternal deaths. The United States already ranks last in maternal mortality among developed nations, and with this decision, it will get worse. In a time when Black maternal mortality rates have reached epidemic proportions, the increase in death toll will be disproportionately Black bodies. As we know, Black communities are over-policed and disproportionately arrested and incarcerated in our criminal justice system. As individual states are allowed to create new anti-abortion laws that criminalize the pursuit of basic reproductive health care, it will again be people of color who are disproportionately criminalized and incarcerated. I'm proud to be living and practicing in a state that's not part of the problem, that's rather seeking to be part of the solution. Montgomery County's $1 million commitment to support access to comprehensive reproductive health care services will help provide access to safe legal abortions, not only to Marylanders, but any American seeking safe legal abortion in our state. These funds will help to safeguard access to care for the people most vulnerable to the consequences of the Supreme Court's decision to eradicate protections to abortion rights. So on the behalf of Maryland affiliate of the American College of Nurse Midwives, I'd like to thank the Montgomery County Council for supporting evidence-based, just, and equitable reproductive health care. And Maryland ACMN looks forward to partnering with Montgomery County to provide comprehensive reproductive health services to patients and families we serve in your communities.
Thank you. Ms. Nelson?
Good afternoon, everyone. I also want to echo a huge thank you to the county executive for, number one, inviting Planned Parenthood to be a partner, and also for his bold move in setting this fund. This is a great example of, this is just not words and symbolism. This is creating healthcare within Montgomery County and setting an example of how governments really can work with the healthcare community to continue to provide access to healthcare across the board. Today, I'm coming to you as a representative from Planned Parenthood advocates of DC, Maryland, and Northern Virginia. And I can tell you, this is just the example that we need to see. We need to see working across the board and in other areas of Maryland and other areas of government. It really shows how public policy does continue to create access, and why we only have access to healthcare when we have good programs and policies in place. So healthcare workers can care for people, and they can care for people within the healthcare settings, like the 9 health centers across the state of Maryland, including the health center right here in Gaithersburg, where the Planned Parenthood of Metropolitan Washington provides care every single day for patients who need to be seen in a non-judgmental environment. And what I want to echo right now also is that this is not a drill. We know that harm is going to come from this Supreme Court decision. We are seeing it play out right now in Texas. We have a very clear example of what this is going to look like, because it is happening. And the health centers and the abortion care providers here in Maryland are already seeing patients travel from Texas. So it's only going to continue. Even in states like Maryland, we have to worry about access and feel that access could be and is being chipped away when you have a shortage of trained providers, insurance coverage issues, and when there's anti-abortion rules that are imposed at the federal level every time there is a change in power at the federal level. So commend the county executive for doing what you're doing here. The second great example that we have in Maryland right now is the Maryland General Assembly passed the Abortion Care Access Act just this year. It's going to provide an increased number of abortion care providers. It's funding a training program to train new providers of abortion care, and creates equity, which is so important. Equity in care, where Medicaid patients and insurance patients will be provided abortion care, and it will be treated just like any other part of healthcare, because it is healthcare. We're very frequently saying, and very fond of saying, that no judge, no politician, no governmental authority should ever block your personal access to medical decisions, your personal access to healthcare. We are fighting that in Maryland, and along with our partners in government, not going to allow this to happen in this state. So the reports that the Supreme Court is going to overturn Roe is very, very serious and allows other states to ban abortion. Again, not going to happen here in Maryland. Abortion care will remain legal, and Planned Parenthood's affiliates, Planned Parenthood clinics here in Maryland, are still providing care. The doors are open at these Planned Parenthood affiliates, and we encourage anyone who needs an appointment to call the local Planned Parenthood and set an appointment, because the doors are open. Again, I want to thank the county executive for really making this move and continuing to have a commitment to providing care within his county. So thank you.
Thank you very much, ladies. Reporters, do you have any questions for the guests and or the county executive regarding this topic? No? Okay, so we'll move forward then with the public health update. Thank you very much for joining us today.
Thank you.
Thank you.
So back to COVID. As for our COVID rates, the cases continue to climb, and we're now exceeding 200 cases per 100,000 residents. As you can see from this chart, our current case rate is as high as we were at the end of January, and there's currently more transmission of the virus in our community than any time since last fall. The county's test positivity rate is 4.96. That's significantly less than the statewide average and many neighboring counties. As you can see from this chart of testing rates, Montgomery County residents are completing PCR tests at a significantly higher rate than many other jurisdictions. This results in identifying more cases. It's important in helping our residents make informed decisions to further reduce the spread of the disease. However, our test positivity at our county facilities has increased from 13 to 17% over the last 2 weeks. We've learned that when cases go up, so does our testing volume. And we've seen a 19% increase in testing over the previous week at our Health and Human Services sites. As we continue to distribute free take-home rapid tests in our libraries, this past week, we went over 1 million rapid tests distributed to our residents since we started in January. I want to thank DHHS, Emergency Management, Procurement, and our library and rec staff and volunteers for their continued hard work to ensure that anyone in this county who needs a test can get one. Bottom line is that at this current surge, it's lasting longer than we expected, and meaning that more people are at risk of being exposed to COVID as it remains more prevalent in the community. It is not downturned as quickly as people had thought. So we are still somewhat riding a rising wave right now. With many families gathering last weekend for Mother's Day and with graduation, proms, and other end of the school year celebrations on the horizon, I'm concerned that this rise in cases may continue to worsen. Our hospitalization remains low at 4% of hospital beds, but there are 63 hospitalized COVID-19 patients in Montgomery County, and acute care occupancy has doubled since last week alone. Among those hospitalized in our county, unvaccinated patients outnumber the vaccinated 3 to 1. And just as a reminder, vaccinated people outnumber unvaccinated people by multiples of that. So these cases continue to be concentrated among the unvaccinated people in our community. We continue to encourage everyone to stay up to date on their vaccinations, and especially the boosters. And I'll remind people once again, this is not the flu. And we do not yet have flu vaccines or vaccines like the flu vaccine that can be given once a year. And I know a lot of people thought when people started talking about this as being like the flu, that we'd just be getting regular vaccines every year. We're not at that point yet. Our vaccines do not last a year. They can be repeated safely. But if you got a vaccine a year ago, today, your protection is waning. And it's important to get boosted. So until we have vaccines that last a year, which we will be among the first people to tell you that, we need you to continue to keep your vaccinations up to date. It's in your interest and the interest of the people around you. I myself have known lots of people recently who've gotten COVID. I think it's a sign of people being more relaxed than they probably should be, given the amount of COVID in the community. And I still would encourage people to wear masks when you're going inside of crowded places. Speaking of the pandemic and its impact on all of us, I'm pleased to announce today that our COVID-19 rent relief program is reopened for applications starting Monday, the 16th. Eligible Montgomery County renters can soon apply for additional COVID rent relief through the fourth phase of the program, which provides financial assistance for tenants who've experienced a financial hardship due to the COVID-19 pandemic. Again, your job loss has to be related to COVID-19 to qualify for these funds. Funding for this fourth phase comes from the U.S. Treasury, emergency rental assistance, and direct allocations to the county. We've already helped more than 10,000 county residents who are struggling to pay their rent because they lost a job or had to take time off unexpectedly. And the county's helped coordinated $78 million in rental assistance. By the time this is done, we'll be north of $100 million. To apply for funds, households must meet the following minimum eligibility requirements. Household members must have experienced COVID-19 related financial hardship, have a household gross income from either your 2020 or 2021 tax return or from the previous 30 days that is below 50% of area median income. I want to put that in slightly simpler terms. If your income for 20 or 21 on your tax return is below 50% of the area median income, which is around $50,000, then you can apply. Or if in the past 30 days you have not had work or had your work hours reduced to the point that you're not making the equivalent of 50% of area median income, then you also are eligible. So look carefully at the explanations for eligibility. You have to have resided in Montgomery County since August 2021. You have to have an obligation to pay rent formally or informally, and you have to be behind on your rent payments by at least 2 months. If people have questions about qualifications or anything else regarding rental assistance, they can call 311 for more information. It is important to note that this program will accept applications starting next Monday, May 16th, and the applications will run through at least June 30th. I do hope that anyone reporting on this will be clear that the applications begin on Monday. We don't want people calling in today and through the rest of this week thinking they can submit an application when it will not start until Monday. So make sure that your readers or your listeners are clear about the start date on this. We know there are many residents who've been waiting for our portal to reopen. I don't want them to be frustrated by thinking they can apply this week. Additionally, I've asked our HHS department to be as proactive as possible getting the news out about the reopening of this fund. And I've asked them to work more directly with our landlords as there are additional state funds and resources that are available on their end. It's critical that both tenants and landlords know about the funds available to them, and we need this money to get to those most in need as quickly as possible. Addressing the economic impacts of the pandemic is going to take a sustained and intentional effort by governments at all levels. We want our most vulnerable families that have been negatively affected by COVID-19 to be able to stay in their homes. And this fourth phase of rental relief will help us do just that. I'm very appreciative to our state and federal partners who've helped our county in this collective work to keep our families whole. And I want to thank everyone and turn this over now to Sean and Dr. Stoddard.
Thank you very much, Mr. County Executive. So building off the high-level information you just received, like previous weeks, we've continued to see the cases go up. Looking at where the rest of the country is, including the states in New England and New York and New Jersey, who appear to have the influx of BA2, BA 2.12 subvariants earlier than we saw in our region. Their case numbers continue to go up as well. We've revised our expectations. This wave appears to be lasting a bit longer than what previous countries had gone through. However, again, our increase in cases have not been as steep as with previous waves, and so this could be because of the very large immunity built up from previous infections, from vaccinations. This could be a little bit of the proverbial flattened curve here, which is spreading it out longer. Again, we are closely tracking the hospitalizations and the serious illnesses. We did see those go up modestly. Again, looking at the case numbers, one thing we're sharing in this week's Pulse report is case rates by vaccination status. Again, you can see that most of these cases are the completely unvaccinated, or a much higher case rate is completely unvaccinated. Because we have so many more people who are fully vaccinated and even boosted, that does result in larger numbers of that group, but the case rates are very low. Looking again at our percent positivity, as our county executive shared with you, that rate is relatively low. It's under 5% for public and private partners. At the public HHS run testing sites, it is considerably higher. It had been at 13% for a few weeks. It's now at 17%. I think some of this is the difference between individuals coming out for symptomatic testing at county sites and individuals who may be doing workplace or other asymptomatic screening that is lowering that positivity rate a bit. But these are both important parts of our mission. Those places that are doing routine screening, which includes our congregate settings like our living facilities, our shelters, our correctional facilities, those are very important to try to catch every case before they enter into that setting. Again, we have seen the acute cases go up. The ICU cases have again remained fortunately very, very low. Many of these hospitalizations appear to be turning over more quickly than they did in previous waves, where individuals were having more significant illness that was progressing to, in some cases, intensive care. So again, we're tracking along with this, but we have seen those numbers go up in the past week. Again, we're also tracking along with the deaths. Again, we're happy to see the numbers come down quite a bit in April, and we would like to certainly keep those down as we move through May. This is, of course, the most important statistic and sobering statistic of our operations against COVID. And even as people have more minor illnesses, we are trying not to lose the connection with the fact that not everybody is that fortunate. The vaccination rates have not changed notably from our briefings in previous weeks. And as our county executive shared with you, our testing across the county sites has gone up about 19% from the previous weeks. We know a lot of people are still taking advantage of rapid tests. If they are getting those results and following the public health guidance to isolate, or people who are exposed to quarantine, again, that is what we are hoping is happening. One bit of data we wanted to share that came out a few weeks back. I won't spend a lot of time on this. I know it's available publicly through the CDC's Morbidity and Mortality Weekly Report, but it is a little bit of a retrospective review of seroprevalence. Again, they tested a large number of people across the country to see how many individuals exhibited immunity antibodies specifically to COVID infection, not inclusive of vaccination antibodies. And what they saw was a very, it had been a very gradual increase over time up till December. And then from December to February during Omicron, not surprisingly, that the the number of infections that were detected through the seroprevalence increased dramatically. And one of the other things to take note of is how it affected people. And it's our youngest populations who had the most infections by rate of seropositivity, and our seniors showing the least infections. And that there could be a number of reasons for that, including our seniors are the most vaccinated group, the most up-to-date group, as well as the group that has shown traditionally the least number of cases. They often are engaging in less congregate activities as other groups who are in workplaces or schools might be in. But this is a very important study showing how the actual infection immunity had increased across the population. Again, just reiterating that we are sharing rapid tests and N95 masks still at all of these library sites. We'll begin not only sharing the take-home PCR tests at a number of rec sites, but we'll also have rapid tests at those sites too. And we're trying to educate the population to show up on which test makes more sense for them. Those are the public health updates for this week. At this point, I'd like to give Dr. Stoddard an opportunity if he has additional comments to add.
I just want to echo some of the things that Mr. O'Donnell alluded to. Now, with the increasing cases, now if you have a family member who is immunocompromised, if you yourself are immunocompromised, if you have, concerns about, underlying health conditions of any kind, this is probably the time where you should be more prudent about the activities you participate in, the things you do unmasked in indoor settings with large numbers of people. The cases are high right now, and obviously we've talked about this living with COVID, the endemic portion of this pandemic. The endemic portion of this pandemic does not mean we ignore COVID and pretend it doesn't exist. It means we, modulate our behaviors and our responses to case rates based on our own individual and personal risk. And so now is definitely the time where if you've got those conditions that make you at greater risk of morbidity and mortality from COVID-19, that you do take advantage of, utilizing masks while in large indoor spaces, avoiding going into spaces where the air turnover rates are lower, things like that. And so you should apply some prudence in your own individual circumstances and apply your own risk assessment to the situations. This also underscores the point that everyone needs to take advantage of these boosters. If you are eligible for a booster and have not received it, please go get boosted. You will be protecting yourself, but you will also be protecting everyone else around you by reducing your risk of experiencing COVID, not just COVID infection, but also an infectious case of COVID, meaning you'll have lower viral titers if you're vaccinated, and therefore are less likely to shed virus and transmit viruses to others. So these are not risk elimination tools. Again, these are risk mitigation tools. And that's what we're trying to do here, is try and reduce the overall risk to the community, even when we're seeing these increased numbers of cases. So that's certainly a recommendation that we're making, that people just apply their own risk assessment, and please do be safe and cautious and smart given your own personal health risks. So, and those health risks of your family members. So that's all I have to say.
Dr. Stoddard, I just wanted to add two things off of that. One other recommendation, now that we are officially in that moderate community level, one additional recommendation from the CDC is that individuals who are at higher risk, whether they're immunocompromised, they're at an older age, they're recommended to talk with their healthcare provider before they have COVID and find out, learn more about the therapies, find out if they would be a good candidate for the therapies, so that if they happen to get a positive test, they already know, they've already established what that course of action is. So we do recommend that. Again, for the, the data I just shared about the seroprevalence at different age groups, many of our populations are multi-generational populations. So you have grandparents and great-grandparents living with their children and their grandchildren. And you see how those infection rates rose for some of the younger populations. And many of our seniors are protected because they don't have that contact. But if you are in a multi-generational setting, we strongly encourage you to get those boosters, to protect yourself. So thank you for a few minutes to add those 2 points.
Thank you,
Just, I
gentlemen.
want to add one more point to this, just from personal experience. Some of the antivirals have to be given in a short window. And So I experienced not being able to get an antiviral because I couldn't complete my telemedicine appointment within the first 5 days. So on the 6th day, I completed my appointment and I said, so can I get the antiviral? And they were like, no, has to be administered in the first 5 days. So if you've got it and you want treatment, you should seek it out earlier than later, because you don't want to be told that you can't get the medication. In my case, COVID lasted 14 days. I would have preferred it not to last as long.
Thank you, Mr. County Executive. We're going to open it up now for the Q&A portion of this presentation. Rebecca Tan, Washington Post. I believe you have questions for the County Executive. Good afternoon, Rebecca.
Good afternoon. And yeah, for anyone who can answer this, really, I was intrigued to find out that this wave is lasting longer than expected. And I really just want to understand, I guess, from a high level, why this might be the case in Montgomery County.
I think it's the case everywhere.
Yeah. So
I mean, because people anticipated it would follow roughly the exact same pattern as Omicron, quickly up and quickly down. It apparently is a little slower going up and maybe a little slower going down. That's my non-medical explanation.
Yep. Go ahead, Sean. Go ahead.
Yeah, I was just say a lot of, we look at a couple different models that help predict it. A lot of the information we have, of course, is places that have experienced these variants before we have, and have had similar experience with the BA1 variant. And it's not foolproof that we're going to have exactly the same experience. We saw countries that are very close in Europe even have quite different outcomes. Germany looked quite different than England and France. But again, given the levels of BA1 that we saw in England and France, and how similar it looked to what we experienced, and the modeling we used out of Seattle to kind of predict this, we did think it might be a shorter turnaround, about 4 weeks up to the peak, about 4 or 5 weeks, and then coming back down in a similar manner. But again, what we, going back to the early modeling of when you flatten the curve, you don't necessarily stop all those infections, but you spread them out over a greater period of time until, again, this BA2 and the other subvariants, they're novel enough that they are infecting people who had BA1, unfortunately, not as seriously as people who are unvaccinated or did not ever get immunity from previous exposure. But it's taking a while for us to go through where those transmissions will eventually stop. So we do think that certainly the level of immunity in our community, both gained through infection during the first Omicron spike and conferred through the high rate of vaccination in our county, is helping to slow this spread, make it not as sharp as that previous spike, but it's elongating. It appears to be elongating it too. Again, like I said, we're looking not only now at this point, we're looking in the US at communities that had that started going up earlier than we did, and it won't be perfectly predictive of what happens here, but we'll be a little more hopeful when we see some of those New England states start to come down.
The only other thing I would add is that we're actually seeing a wave that is not necessarily a single variant. I think Sean was alluding to this. And so we're actually seeing evolution within the variants. So the BA2.12.1 has also increased significantly, which has also helped to likely continue the wave longer than expected as that evolution occurs. And this is the unfortunate reality of this quote unquote endemic phase that we're seeing, is that it really is still, the virus is evolving, and it will continue to evolve as it has increased exposure to human beings. And really the hallmark of our collective national and international response is that we've largely been comfortable living with COVID in most places. And what that means, the virus is going to continue to adapt in its own way to infecting human beings. And so we tend to try and project what it's going to do, but it evolves and it makes modifications to its own structure that allow it to avoid the immune system or transmit faster. And we're seeing this with BA4 and BA5. There's a there's a natural selection for transmission rate. So that obviously means that our projections of how things are going to evolve need to incorporate some of the uncertainty associated with the fact that the virus is evolving to become a more efficient infector of human beings. And so what we would have expected for Omicron BA1 is not necessarily what we should expect of Omicron BA 2.1, 2.1, or BA4 or BA5, or unfortunately something beyond Omicron, whether it's, I don't know, they'll use pi or rho, but I think that there will be other variants, not just subvariants, and the pattern and predictability of those variants as we experience them during the times of the year that we experience them will greatly impact the projectability of how long waves last.
Sorry, and just a quick follow-up and then a more extended follow-up. But so the county hasn't reached its peak, right? Because it's probably going to get a little worse before we reach a peak, right?
Again, it does seem like they're still trending in that direction. And as we see testing pick up, we're going to find more and more people. And that was, I think, one of the important things. We did a deeper dive on testing levels. We find out a higher percentage of cases because of the large amount of testing going on. But we do anticipate it'll be at least another week or so before we hit that peak. This is, again, where modeling is. I would love to be wrong on that and it starts to turn around tomorrow, but yeah.
Got it. And another follow-up question. So when it comes to public health intervention, so in previous waves of the pandemic, right, we've seen when there's been a peak, people respond to that by staying home or wearing masks or doing that. Are we seeing people respond to this surge in the same way that they did to Omicron or to Delta?
It's, there was we were in a very different place also in a December and January spike. Very cold, people who were indoors. It was the holidays, people continued to gather, and that certainly exacerbated it. We are hoping that the gatherings are smaller at this point. We know we just had Mother's Day. We know we have graduations, we have other things. In the past 2 years, many of these were smaller gatherings. I do think socially, people are looking for things to be back to normal. We just ask them to be cautious, right, when they're doing these things. And a great way to do that is if you're having a gathering, rapid testing is ubiquitous. Test before you get together. Test before you see those people who are higher risk, your older family members or other folks who are immunocompromised. The behaviors are a little bit different. Some of it is, I think, calendar. Some of it is, it was the previous wave was just so many more individuals. And we actually had a far larger number of people who were being hospitalized during that wave and more deaths related to that wave. So this is quite a bit different right now. And I think their behaviors are reflecting it to some degree. There's less number of serious illness.
The only thing I would add to that statement is I think it varies a little bit by population. I still think you see the older population being mostly very cautious in most settings. I see a lot of indoor mask wearing in that setting. And obviously, I think we've learned a lot in the setting of young people, schools, childcare, et cetera, where you're obviously seeing far fewer restrictions. And frankly, the seroprevalence data that Sean alluded to shows that there's been just a tremendous number of infections in those environments. The seroprevalence in the youngest population is the highest of any category, and that's because you're seeing more exposures and infections in young people. They are less serious illness. So I'm not advocating that. We're not talking about closing schools. We're not talking about mask requirements in schools. But we are seeing a much greater tolerance for risk in the school setting in light of the harm caused by doing some of those things and the risks. We're not seeing increased risk of hospitalization necessarily in our youngest people as well. So there are changes. They're not just changes in behavior, but they're changes in risk perception driven by data, which is, I think, important. So we're still seeing a great number of our older population still wearing masks, still limiting exposure indoors when we have high levels. We're seeing less of that in the younger population, but again, that's not just the younger population is ignoring it. That's the the risk assessment and risk trade-off and risk balancing that we talk about that I was referring to earlier. And so different people are going to have to make different assessments. And that is not to say that some people are just ignoring it and other people are caring more about it. It's that the risks posed to different people, different families, different situations is very different.
Thank you.
Thank you, Rebecca. For those of you watching through County Cable Montgomery, we do have a hard stop. This will finish on that broadcast in about a minute or so, but you can transition to the county's Facebook page and or the YouTube channel. This will continue there. With that, Steve Bonnell, you're up next. But that's a beat.
Afternoon, everybody. Can you hear me? My mic's been wonky today. Good. I want to return to the rental assistance program news, and I can follow up with Amanda Harris if you don't have the info handy. But this current tranche that starts Monday, do we know how much money will be in that and how many people that will be able to serve?
I don't know. I believe it's a total of, I think I want to say tranches, 2 tranches of 8 and 6 million. So combined 14 million, I believe, is the total. We can confirm that with Ms. Harris. But obviously, I think the cap for individuals is I think up to $10,000 with arrearages. And so it will depend on the nature of the applicants and what the total pool to be served are. But I think that's to give you a sense of where we're at. But certainly, I think Ms. Harris will have more specific information about there are definitely 2 tranches of money that we have added that add up to a total of something like a total of 14.
And the demand for this program, as you all know, has been significant since you all started distributing money. And, you know, I don't need to tell all of you that the federal money is going to and state money is going to drive eventually. And I'm just curious what the counties and Dr. Stoddard, and I guess the county executive can both field this if they want to, but what is the county's kind of long-term plan when, you know, the money dries up? Hopefully most people will be served by then, but I imagine there'll still be some people that need help. So just kind of a broad question about kind of long-term plan and kind of outlook at the county once that happens.
You want to start, Mark, or I can't? Sorry. You're muted, by the way. Mark, you're muted.
Mr. County.
Yeah, I realize that. So we're going to have to navigate this as we go forward. We don't know what that need is, but we know, for example, that, you know, the limits on our program in order to get them out to the people who were most, you know, hard hit by this were limitations on the incomes that were eligible. There were incomes that we weren't able to serve at all. So we imagine that need is still out there. And I also believe that after we finish with everything we're doing, that's still not enough money to address probably a decent number of folks who aren't going to be able to get this assistance. The council's going to have to look at this. We still have some, I believe we still have some unspent ARPA money. That's a target. I know the council's thinking about what to do with the ARPA money that we haven't obligated it in the budget. I think this may be something we want to hold in reserve, an amount of money to actually assure that we can reach out and serve more people, because we know we're going to need to do it.
The other thing I would add, Steve, and this just goes to the county executive's overall goals around affordable housing, is that there is a big continuum of efforts that are aimed at addressing the imbalance that exists between what people can afford to pay in Montgomery County and what exists in terms of housing. And so there are a tremendous number of efforts around looking at spaces that the county currently owns that can be utilized to build further affordable housing. There was a $40 million proposal within the county executive's budget to sustain the existing affordable housing that's out there. And so this is all a continuum. So rental assistance doesn't exist in a vacuum. It's part of a significant other package of programs aimed at making Montgomery County more affordable and protecting the affordable housing that we already have, making sure that it's not lost to developer profits.
On that topic, I'm seeing that the council might take up a capital budget amendment item to try and encourage development of the Chevy Chase Library site. I know, Mr. County Executive, you were kind of waiting to see what the proposals are. Is there, is there like a magic number of affordable units that you would like to see at that site? Or I guess what would you want to see more broadly speaking for you to be supportive of that?
Well, first place, I want to remind you that I'm the one that initiated doing a study there, so we could see what could be put there. You know, if we can do this in a way that makes economic sense, in other words, if we don't wind up spending money that we wouldn't have otherwise spent, and a lot of it, in order to yield units, then it would be worth doing. If it's a matter of we wind up spending money we wouldn't have otherwise spent, for example, you know, this started out as a library refresh, which was not terribly expensive, and we've been parceling out these refreshes so we could bring all of our libraries into line. If this graduates to actually a refurbishment, which is more than a refresh, depending on the cost of that or whether they determine they need to take down the library altogether, then the options are different. The county would have to pick up probably undergrounding parking, which is not an expense we would have if we were just doing the library. And if we build to say an all new library, which if all we had to do was simply refurbish the library, we would be incurring additional expenses on the library that we wouldn't have spent otherwise. So you've got to look at all that taken together to see whether it makes sense to put that much money into doing affordable housing there, or are we better off doing affordable housing in another location? For example, you know, we've put these 18 parking lots, empty lots and garages up for redevelopment, you know, most of them in downtown Bethesda and Silver Springs. So if we need money there, is that going to be a more efficient use? But because we don't have detailed responses, and some of the responses we got back had no affordable housing whatsoever, and I am not going to do a project which has no affordable housing. We want to see what we can bring back that makes sense, that brings this project back in line with what we'd expect it to be, and doesn't unnecessarily drive up the cost of a library, which really then becomes the cost of providing those extra units. So, you know, this wasn't in the budget, I think, until 26, 27. You know, it wasn't something we were doing immediately anyway, but we're re-examining it, and then we'll look at a more refined request for proposals to see if we get things that more closely match what we need to do.
I know you've heard this, County Executive, but a lot of the advocates point out it's right near Purple Line Station. It's in a relatively, well, not relatively, like pretty expensive part of the county that needs more affordable housing. And I just want to give you a chance to respond to kind of those that support for a project at that site.
So look, it's in the plan area of Chevy Chase Lakes. It's part of the Chevy Chase Lakes plan. And the Chevy Chase Lakes plan has a lot of affordable housing, not as much as I'd like, but as much as we ever get, close down to where the actual Purple Line station is. So it's not like the neighborhood or the community is not going to be seeing a substantial increase in affordable housing. I don't just do things if it doesn't make sense economically. And that's been my issue from the beginning, is does this project make economic sense? Or would I get more bang for the buck if I put dollars someplace else? I honestly don't know the answer to that question yet. And when we know the answer to the question, then we'll figure out what we're going to do with it. But, you know, the advocates don't seem to be concerned at all that we've got condos in Bethesda where they get exempt from building affordable housing in the condos. That segregation doesn't seem to bother the advocates. The fact that we get a few MPDUs, and then most of what's built in Bethesda is unaffordable to people making more than MPDU and qualifying incomes. That doesn't seem to bother people. People are really selective about what bothers them, is what I'd just say in general. This is just political largely, because if I wasn't interested in this, I wouldn't have asked our people to explore what the options were in the first place.
But to clarify, you don't have a number of like, you want to see this many units, or a number, I'm guessing you're not going to tell me about, like, this is too much money to spend.
So no, but look, if you look at the units drive parking spaces. So you can say, okay, I'm going to build this unit, and that's a great thing. But if parking spaces cost us $30,000 or $40,000 of parking space, and that's not reflected in the unit price. Those are things we have to think about. You know, what is it going to cost to park an even bigger project? So I don't know the answer to that question, which is why we're going to look for more responses to see if we can refine what people are proposing, get people to attach some prices or what they're willing to do for the amount of housing they're going to get, to see what makes the most sense for the project there. I mean, like I said, I wouldn't have started down this path if I wasn't interested in trying to do something.
The last question I have kind of dips into your historical knowledge a little bit. The Board of Ed announced the Monifa McKnight's kind of permanent salary at about $320,000. You obviously were a former teacher. How does that kind of compare to other superintendents? You know, I think Jack Smith was the prior superintendent. I just wanted to see if that seems right for you. I know obviously the board has their own decisions to make, but just wanted to dip into your kind of knowledge there.
Yeah, so, you know, I didn't have experience. I didn't pay attention to superintendent salaries, honestly. It wasn't something I ever focused on. I was more interested in educational policy. I'm pretty sure the school system's going to set a number that they can defend as being comparable to what similarly positioned people make. I will give them the benefit of the doubt that they've done that analysis.
No, thank you, everyone.
Thank you, Steve. Jack Moore, WTOP, good afternoon.
Good afternoon. Question back to COVID. Now that we're over the 200 case count, which puts us into medium, the next trigger points, I believe, would be looking at hospitalizations. And I think they would have to rise pretty dramatically from where they are to then go into the high category. But I'm curious, given, I know nobody has a crystal ball, but, kind of given the trends that we're seeing, do you think that the hospitalization trigger would be reached in this surge?
None of our models really has us getting close to that level of, at the current translation of case rates to hospitalizations, it does not appear that would be possible. It would have to, as Dr. Stoddard said, it would have to be another presentation of the subvariant causing a significantly more significant illness related to those infections that we're just not seeing right now. And again, there's those two metrics. There's new cases into the hospital setting in the 7-day period, and there's percentage of beds filled. And if either of those gets over 10, you would be in that high category with the case rates. But I think we're seeing the hospital turnover more quickly than we have in the past. That was a major problem in those first few waves. People were hospitalized for weeks and weeks at a time and moving from acute care to intensive care. Again, we do not expect that to happen.
Thank you.
Thank you, Jack. I do not see any more requests for questions from members of the media. Going once, going twice. I guess we're done for today. Thank you, everybody, for joining us. Stay safe.
Thank you.
Thank you. Have a great afternoon, everyone.
Bye.